So today I'd like to get back to basics and discuss some of the common tests that we as cardiologists do in our clinical practice. Among the most common tests that you may encounter when you visit your physician or your family doctor is what we call an ECG or electrocardiogram. What is an ECG? What is the electrocardiogram? Well, the electrocardiogram is actually an electrical tracing of the heart's activity. This is done at the bedside. It's a very simple and non-invasive test that can be done within a few minutes with you as a patient lying down flat. It's a test that gives us a lot of information as to how the heart behaves. So when the heart beats, there's an electrical impulse that goes through the heart that causes the heart to pump. And electrodes or stickers are attached to the chest wall to the electrocardiogram machine. So what can we see from the ECG? I'll show you a copy of what a normal ECG here looks like. 12 leads that can be seen on the electrocardiogram. And from this, we have a window as to how the heart's behaving. The ECG can often be done for a number of reasons. Why would your doctor ask a request for an ECG? He may do this as part of a routine medical examination, and quite often an ECG is done part of a medical checkup or during pre-op assessment before a patient goes for surgery. The ECG can also give us information when someone presents with symptoms of chest pains, difficulty breathing, or palpitations. So when the patient presents to the clinic, and your doctor may request an ECG to see if there's any heart-related abnormalities. So whilst the ECG is a very useful tool in terms of helping the cardiologist decide what heart condition you may have, there are limitations to the ECG. I think it's important to realize what an ECG doesn't do. Many patients have often asked me whether an ECG can tell you whether there's any blockages. The ECG is not a heart scan, so you will not be able to tell whether you have any, the severity of the blockages or heart blockages. For that matter, you won't be able to confirm whether the blockages are mild or moderate or severe. Now, so what can we do to confirm whether you have a heart problem or not? I think while the ECG is useful, if there is a hint or suggestion that you may have a heart condition, then as I said earlier, you may have to stress the heart out in order to find out whether you have a heart blockage problem. And to do this, there's a variety of other tests. And one of the tests I'll be talking about in the next session would be the exercise stress test or the treadmill test. So in fact, almost anyone can have an ECG done. The most common reasons why someone comes for an ECG would be when they have symptoms of chest pains or shortness of breath, difficulty breathing, or sometimes even when patients present with giddiness or palpitations, irregular heartbeats. An ECG would give us a window as to what is happening with the heart. So in summary, the ECG is actually a very simple test. It can be done for practically anyone as part of a routine screening, or when you have a symptom where the doctor may want to find out more information regarding your heart. As I said earlier, the ECG is a non-invasive test. It's simple to do, so there's no radiation, it's non-invasive, there's practically hardly any risk involved with it, and it's cheap to do. And it takes only a few minutes, and it's often available in most clinics nowadays, whether it's at the family clinic or in the hospital setting with a physician or with a cardiologist. Well, thank you for watching. I hope you liked the video. If you do, please don't forget to like, share, and comment. Thank you.